Goromila Mayogada Alaskam Corla. I wish to support my party colleague here, Billy Kelleher, in bringing forward this very important and indeed crucial vote before the House here tonight. I don't wish to go in any way to personalise this, because that's not what the public at home are looking for. Indeed, that's not what any of us here wish to do in this House either. Health in the current time and at any time is one of the most essential services that a citizen can need and need access to. And it has to be at a time whenever we are facing into cuts to our budget, the #1 priority for a government in ensuring that services are protected. And unfortunately, Minister, you, up until 18 months ago, were in this side of the House as opposition spokesperson for health. And you talked the talk in terms of what you would do if you became Minister. You, along with your party colleagues and government colleagues now, made several promises in terms of what you would do if the public elected you into office. Memorably, during the election campaign, the Taoiseach himself stood in front of a campaign meeting on a street in Roscommon and promised that should he be elected to office, there would be no change to accident and emergency ward there in that town. We have seen, Minister, where that particular promise has gone. And we've also seen, Minister, where the stance you took here in opposition has led us to. Unfortunately, for a party that promised universal health insurance were it elected to office, what we've instead seen, Minister, is 55,000 people leaving the private health insurance last year, now in the public health system. Instead, Minister, of the reforms you promised and of money following the patient, we've instead seen a situation whereby hospitals across the country are being asked to make cuts regardless of how efficient they are or regardless of the amount of treatments that they carry out. On coming into office, Minister, one of your first actions was to abolish the HSE board. That followed on recently with the CEO of the HSE moving on and being appointed, Minister, by someone of your own choosing. Unfortunately, it is now appearing, and it has appeared for a long time now, that one of the key problems with the inactivity and lack of progress in relation to our health service and reform of the health service is, unfortunately, Minister, your own leadership of it. And that has never been more apparent than whenever some of your own ministerial colleagues and indeed departmental colleagues have refused in several instances to actually express confidence in you. And with a year and a half into government and 3.5 years left, Minister, in the most crucial portfolio of this government in many ways, for a situation to have arisen whereby colleagues are actually not expressing the faith in you which you actually require in order to go on and carry out the type of reforms that are needed. Minister, I feel, unfortunately, there's only one alternative, and that is this motion of no confidence here tonight, and indeed for you yourself to consider whether you are going to be in a position to actually continue on this role and deliver the actual reform and change that is needed. We've seen a situation, and it just didn't arise this year, but we see a situation, Minister, in the health service whereby the HSE were asked to put together a service plan for this year, which we didn't see until the end of January. Then we had the regional health, the HSE regions asked to put together regional health plans, which again weren't signed off until the middle of March. How, Minister, are we supposed to be able to plan a health service for a year whenever the actual plans for the service itself aren't actually agreed until halfway during the year itself? We've also seen a situation whereby, unfortunately, in putting together the budget yourself last December, you premised it on many things which you then subsequently were not able to achieve and did not follow through on. There was supposed to be a saving of 124 million in drug payments via a new pricing agreement with the industry. Unfortunately, this in June was described as unachievable by the outgoing HSE CEO, Cathal McGee. It was also assumed, Minister, that there would be an additional 140 million from increased private income. But that assumption again in June was described as not deliverable by Cathal McGee again. Reducing agency costs, Minister, by 50% was a further target, again described as unrealistic by the HSE CEO. So we found a situation whereby, because the budget you actually introduced back in last December were based on figures which were not going to be unachievable, we faced into a situation whereby halfway through this year the HSE was facing into an end-of-year deficit of 500 million. And what was your reaction to that? Instead of taking leadership of the HSE, a HSE which you'd abolished the board of because you wanted it to be closer to yourself, you instead sent the HSE officers out to announce cuts a couple of weeks ago and went into hiding yourself as opposed to taking responsibility for it. That, unfortunately, Minister, was a reflection of where our health policy in the last year and a half and under your stewardship has come to. This was followed once again by members of your own government coming out saying they weren't aware of it, and indeed in many instances again refusing to actually express confidence in you. I would ask, Minister, how do you plan to continue on and provide the leadership to deliver the reform that we require, if that is the situation that you find yourself in now? I would like to take us back to take back the type of reform that is actually required to the region I know best, and indeed the hospital I know best, and that is that of Letterkenny General Hospital.
Over 2 minutes remaining.
Thank you, Laskin Corla. Where we have seen very real examples of your failure to actually introduce a policy whereby money follows the patient. It has seen a situation whereby its spending has gone from 105 million 2 years ago to a situation where you were asking it to come in on a budget of 92 million this year. That is with no respect whatsoever to the amount of treatments that are carried out, to how efficient that hospital is, or to the impact that any cuts that you may be bringing in will actually have in services. Yet we have other hospitals which may not be nearly as efficient being asked to cut their budget to a similar amount. Again, hospitals which may actually have capacity there. But whenever you don't, Minister, go and take a realistic look at what is being delivered for the money that is being put into the service, you instead are setting up a situation whereby there's no correlation between the funding cuts that you're asking to be found by management and the actual treatments that may be delivered on the ground. So, Minister, I would ask you, having come to this impasse whereby you've taken over leadership of the HSE and got rid of the board which was responsible for it in the past, yet you seem to have lost that very leadership that you took on board, and your ability and the confidence of your colleagues to actually deliver on the very important job of actually delivering a health service and delivering real reform. I think it's time you considered your position and actually went back to the government and reconsidered what type of leadership is needed in order to deliver a health service which people out there very much require and need. Thank you.